Hello, everyone. Welcome back to another episode of SNS Medicine Made Simple. My name is Sukesh, and this is.
Facial.
And today we're going to be starting our first episode of the Rural Healthcare Roundup, otherwise known as RHR. And today we are joined by Dr. Kibar. Dr. Kibar went to medical school at the American University in Beirut, Lebanon. He completed his internal medicine residency at Wichita, Kansas, and did a geriatrics fellowship in St. Louis. And Dr. Kibar has been a rural healthcare physician for a long time, since 2003. So yeah, go ahead and take it away, Dr. Kibar.
Yeah, hi. Like Sukesh said, I started practicing in rural Kansas in 2003, and I practiced 18 years in a town that is around 1,000 people. And for the last couple of years, I moved to Harper County, and I've been practicing here for a couple of years.
Awesome, awesome. Thank you so much. So we just have a list of questions we're going to ask you to get to know you a little better, as well as really talk about rural healthcare and rural medicine. So Vice, should go ahead and ask our first question.
Doctor are you?
I'm sorry, it's got cut off a little bit.
Yeah, she said, "What type of doctor are you, Dr. Kibar?"
Okay, so I am specialized in internal medicine and geriatric medicine. So basically, doctor for adults and older adults. And I did also a little bit of pain and palliative care before I started my practice. But mainly, when you go to practice in small towns, you end up practicing much wider range. And I became more of a primary care physician, seeing kids and addressing women diseases, women-related diseases.
Awesome, awesome. Thank you so much. The next question we have for you is, why did you decide to pursue rural medicine?
First, at the beginning, it was not much by choice because I'm a foreign graduate. I had to get a green card by working in an underserved area. And since I did my residency in Wichita, it seems to be logical to work in Kansas. And that's how I ended up working in rural Kansas. But after a while, I enjoyed my work over there. I enjoyed some aspects of it and decided to continue working in rural Kansas.
Awesome, awesome. Yeah, we're so great to have you. And I've known Dr. Kibar for about 2 years. We both work at the Mayflower Clinic and we volunteer there. And I've been able to shadow him, and he's one of my favorite doctors I've ever shadowed. So,
well, thank you.
Yeah, thank you so much.
What is the most serious case you've seen?
I've seen all kinds of serious cases, from coding, people dying, and we had to do CPR on them, to strokes, where we had to actually give blood thinners through the artery, I'm sorry. And I take that back, it's through the vein. And heart attacks. We've seen trauma from because we are on the highway. We used to see here and there some bad accidents, bones sticking out. Probably the good thing that I never saw a lot of gunshot wounds or anything like that, since we live in a very small town. But yeah, we've seen a lot of serious patients. And
Wow.
our mission in rural Kansas is to stabilize them and transfer them to a higher level care.
Mm-hmm. Right, right. For sure. Do you want to follow up on that, Vaishu?
Well, why did you even choose to be a doctor?
That is, yes, it's probably a couple things. My dad was a teacher. He wanted us to focus a lot about studying and getting better degrees. And I was good at school. And in third world countries like Lebanon, where I come from, you either have money or you need to do something to get a good job. And being a doctor was one option. But then in addition to that, of course, I enjoyed learning, because when you become a doctor, you learn every day. I enjoy reading and I enjoy helping people. And that's why me and Sukesh, we volunteer at Wichita. I do go there every other weekend, and I've been doing this for more than 7 years. We see patients for free. We try to get them medications for free. We do labs for free. So it's a combination of factors. Definitely having a good, sustainable job in a third world country. But then, of course, helping others and keep learning.
Yeah, and following up with the Mayflower Clinic, could you tell us more about really? So you are the medical director there. Could you tell us more about how you got started, what the mission is there, and how we've been able to impact the community of Wichita?
It's very interesting how it all started, because they just started the clinic, and one of the board members knew a friend of mine, and they were started looking for first they started looking for financial support and doctors. So he talked to me, and because I still go to Wichita almost every weekend, I said, sure. I have free time on Saturdays. I'll start helping on Saturdays. And since then, it's been a joy to be able to be part of this wonderful group who donate their time, donate their efforts to help people who don't have insurance. So that's the clinic started is basically to help people without insurance. We ask for $10-20 donation, but if they don't have money, it's okay. We still see them for free. We do basic labs for free. We try to get them medications for free. And slowly but surely, we are hopefully growing and adding and seeing more patients these days.
Yeah, and I know that since I joined 2 years ago, that we have rapidly expanded our patient base, more like exponential growth in a way. So, and I'm really
that's true.
I can be a part
That's true.
of the mission. So yeah, Vaishya has the rest of the questions aren't as difficult, I should say. So Vaishya has one more easy question and one more hard question, and we're gonna wrap up the interview here. So go ahead, Vaishya.
Well, what's your most favorite experience as being a doctor?
Like a funny story you'd like to share.
I am not good at remembering stories, although if you gave me time, I probably would have remembered something. But I am not good at remembering stories, so sorry, I don't know.
Yeah, but is there one memorable moment that really made you love medicine? Maybe.
Well, the memorable moments are basically your relationship with the patients, which is very important in rural Kansas. So you kind of occasionally you develop a friendship relationship, because it's a small town. People know you. You get to know them outside the clinic, and that is part of rural clinic. I would like to advise people who think about practicing rural medicine, especially in rural Kansas, that there is a certain lifestyle that you need to enjoy, maybe including golfing and hunting, and you need to try to be part of the community, not just go provide you with your medical services and leave. But yeah, I mean, there are a lot of stories that are really important to me. I just I just saw a patient a couple weeks ago who actually died and came back from death. And I have seen her for a couple of years now. These things definitely impact you and impact the way you see things.
Yeah. But and that's been it. You've been able to give better care because you do know the patients outside and you do know the patients for a long time.
Definitely, definitely. That's part of the whole rural clinic or health care, is that you get to know patients in the clinic and outside the clinic, and that will give you a larger image of their lives, so that you'll give better care. Yeah, no doubt.
Yeah. So our last question for you is just kind of a general question about rural healthcare. You know, there's been a rural physician shortage for a long time now. In Kansas, it's getting better, but still the situation is not where it needs to be. So kind of our question is, it doesn't have to be addressing the rural physician shortage, but what do you think is the biggest challenge for rural healthcare going forward? And do you have a solution for that? And if you don't, that's okay.
Well, the biggest challenge is the shortage of providers everywhere, which means when you apply for a job, you have a chance to work in the biggest cities in the world, to big cities like Kansas City, to small cities like Wichita. So unless you have some family connections at a small town, it is hard to get someone to work in a small town. It is hard. And then comes up the compensation. Can I be totally honest? If the compensation is the same between a small town and a bigger town where yourself and your family have more options, more things to do, then you end up being in a bigger town. So unless the shortage all over the United States gets solved, the shortage in rural Kansas or rural area in general is going to continue. And small towns, most of them don't have the capacities to offer bigger salaries or anything to lure medical doctors to their towns. I come here. I'm working. I've been working here in Antony for a couple of years, like I said, but pretty much 3, 4 out of 5, 6 of us, they were from this area, and they grew up in this area, and they decided to stay in this area, and I'm talking mostly the mid levels, but actually the other doctor is from Arizona, and he still goes to Arizona to see his family. And for me, I bought a house here, and I'm trying to be my best part of the community, and I still commute to Wichita on the weekends. But that is the main issue. That is the main problem. You have to understand that in rural clinics, you have limited options for you and your family. And unless you are willing, you like it, you enjoy it like I do, then it's hard to lure doctors to these areas.
Mm, yeah, no, for sure. And you know, like I said, I really admire you and your work.
Thank you.
The Mayflower Clinic, but the fact that you've been in rural healthcare and the stories you've taught, and most importantly, I feel like if I do make it and become a doctor, you've taught me to be a better rural healthcare physician at some day in my life. So thank you
And
so
like I always told you, I think you're going to be an excellent doctor.
yeah, thank you so much, Dr. Kibar. Well, that
You're
wraps up
welcome.
our first episode of Rural Healthcare Roundup. And always make sure to live happy and healthy. And we'll see you next time. Thank you so much.